I'm Henry Brodaty. I'm the Scientia Professor of Ageing and Mental Health at the University of New South Wales, where I'm also co-director of the Centre for Healthy Brain Ageing, or CHEBA, and director of the Dementia Collaborative Research Centre. As well as that, I work at Prince of Wales Hospital, where I'm a consultant psychogeriatrician and head up the Memory Disorders Clinic. Well, I couldn't believe it. I was really excited. I could feel my heart beating very quickly. It was a complete surprise. I really didn't think I had a chance. And I knew I'd been nominated by my university, and I was really thrilled to learn I won the prize. I mean, the Ryman Prize positions itself as the Nobel Prize of ageing research. It really is something to aspire to for people. It encourages people, it gives it a status. And so I think it's tremendously important. Well, I don't know exactly which bit of research they focused on, but I've been involved in a number of things. So from a research point of view, I guess one of the most important studies that I've published was a trial where we trained family carers in how to look after people with dementia. And we showed we decreased the stress levels of the carers and their depression levels. We kept people at home longer, and so that was good for the people with dementia. And it was cost effective. We saved the government a heap of money because we kept people out of nursing homes for longer. Other things we've done is I've been really interested in trying to improve diagnosis of dementia by general practitioners. So we know that about half the people with dementia, particularly mild or even moderate dementia, are undiagnosed by their GPs. And that's the same in Australia, New Zealand, UK, wherever these studies have been done in the Western world. Probably in the developing countries, it's even worse. So we tried to address that a number of ways. We developed a quick tool for them to use to diagnose it, called the GP cog. It only takes them 4 minutes. It doesn't actually diagnose it, but it tells them who's likely to have it. And they then have to do more tests. Subsequently, we've adapted that for use on the internet, and GPs can download it on their desktop. They can save it or they can print it out, and it's available in about 14 different languages. And we'd like to get some funding now to convert it into an app as well for GPs to use. The next area of my research is more on nursing homes, because we know quality of life can be pretty poor in nursing homes, can be good too, and trying to work out what it is that makes for good nursing home care and not so good nursing home care, and what we can do to improve nursing home care. Other areas of research that we're involved in, particularly through CHEBA, our Centre for Healthy Brain Ageing, is trying to prevent Alzheimer's disease. So we don't exactly know what causes Alzheimer's, but about 30% of the risk can be attributed to 7 environmental factors. And we know if we attack those factors, we can reduce the risk or delay the onset. And because it's a disease of late life, we can delay it for hopefully till after they die. Just delaying it for 5 years would halve the number of people with dementia or Alzheimer's disease in the world. Well, I'd like to achieve several things. I'd like to prove that we can prevent or delay the onset of Alzheimer's disease. So I won't know that for 5 years, but I hope so. I hope we can make what we know is good practice in nursing homes business as usual. That we can convince government that they should be insisting on that or giving rewards for nursing homes that do good person-centred care, not just buzzword person-centred care. That we change the attitudes of staff who are not attuned to this. I hope we can make GPs better at diagnosing and managing dementia. And if they don't want to do it, then let's look at other strategies, maybe getting practice nurses to do it so the GPs can work in tandem with them. So there are 3 goals we'd like to achieve. On a more general basis, I'd like to increase research for dementia. I guess one of my, I'm getting on a bit myself, but one of the legacies I hope to leave is I've trained a lot of people in research, and it's very rewarding to now see them in senior positions and having their own teams. And so it's important that research gets its just funding, and it's important for us to keep pressure on governments to think about this. Because unless we improve care, we're going to have more and more people with finite resources, and we're not going to cope. Even in Australia, now our gross domestic product on dementia is about 1%. And that's set to be 2% in a generation by 2050. That's a big chunk of money. I mean, we're spending something like $6 billion a year. In New Zealand, you spend just under $1 billion a year just on health costs. That doesn't count carer costs, opportunity cost loss, and so on. So governments have to engage with this and come up with better ways of doing things.